Frozen shoulder, also called adhesive capsulitis, is a common disorder that causes pain, stiffness, and loss of normal range of motion in the shoulder. The resulting disability can be serious, and the condition tends to get worse with time if it is not treated. It affects mainly people ages 40 to 60, with women affected more often than men. Symptoms: with frozen shoulder, the shoulder feels stiff, painful, and has limited motion in all directions. Symptoms of a frozen shoulder are stiffness that worsens at first, but gradually begins to improve over time. Dull aching pain that increases as the disease progresses and may worsen when you move your arm. A frozen shoulder may take 2 to 9 months to develop. Although the pain may slowly improve, stiffness continues and range of motion remains limited. Pauses. We do not fully understand what causes a frozen shoulder, but an inflammatory process is probably involved. Sometimes freezing occurs because the shoulder has been immobilized for a long time by injury, surgery, or illness. Fortunately, the shoulder can usually be unfrozen, though full recovery takes time. The process usually begins with an injury such as a fracture or inflammation of the soft tissues, typically due to overuse, injuries such as bursitis or tendinitis of the rotator cuff. Inflammation causes pain that is worse with movement and limits the shoulder's range of motion. When the shoulder becomes immobilized in this way, the connective tissue surrounding the glenohumeral joint, the joint capsule, thickens and contracts, losing its normal capacity to stretch. Trying to avoid the pain caused by moving the shoulder leads to further contraction of the capsule. The humerus has less space to move in, and the joint may lose its lubricating synovial fluid. In advanced cases, bands of scar tissue form between the joint capsule and the head of the humerus. Risk factors. The frozen shoulder risk is increased by the following factors: lack of exercise therapy after tendinitis or an injury, wearing a sling for more than a few days without intermittent stretching, rotator cuff disorders. About 10% of people with these rotator cuff disorders develop frozen shoulder, and forced immobility resulting from a stroke, heart condition, or surgery. Other conditions such as thyroid disorders or Parkinson's disease. Treatment. The treatment for a frozen shoulder is focused on relieving pain and restoring the shoulder's normal range of motion. Treatment for frozen shoulder may include anti-inflammatory medications such as aspirin, ibuprofen, or naproxen. An ice pack or bag of frozen vegetables applied to the shoulder for 10 to 15 minutes several times a day can also help with pain. Corticosteroid injection into the shoulder joint or soft tissues. Physical therapy is the cornerstone of treatment, especially concentrating first on exercises that stretch the joint capsule and later on strengthening exercises. A physical therapist can show you how far to push yourself and can teach you the appropriate exercises. Once you've learned your limitations, you can practice most of your exercises on your own at home. As you work to stretch the shoulder capsule, you should avoid any activities that require overhead reaching, lifting, or anything else that aggravates your pain. If you diligently follow your regimen of frozen shoulder exercises, it's likely that you will be able to resume your usual level of activity. But full recovery from a frozen shoulder takes time from several months to 2 or 3 years. Rarely, recalcitrant cases require surgery.